Welcome to the latest edition of the Mind-Gut Conversation, the interview series about topics related to health of the brain, the gut, and the environment. Today's guest is Dr. Clare Morris, who is professor and director of the Mind Center for Brain Health at Rush University. She's an international authority on the role of diet and cognitive function and the PI of large community studies of risk factors for the development of Alzheimer's disease and cognitive decline and other health problems of older persons. It has been an honor to collaborate on a grant proposal to study the role of gut microbial metabolites in brain alterations associated with cognitive decline. Importantly, Dr. Morris is the author of the fascinating book, Diet for the Mind, the latest science on what to eat to prevent Alzheimer's and cognitive decline. Dr. Morris, welcome to the program.
Thank you. It's a pleasure to be on it.
So let me start out with a quote from the introduction to your book where you say nutrition education is barely a footnote in medical training programs, yet it is at the core of all matters in health and disease. Do you want to elaborate on this a little bit?
Yes. Currently our medical field is, our clinical medical field is focused on drugs to treat disease, and nutrition is the method by which the body gets nutrients in order to function and protect itself. So the fact that medical education doesn't incorporate more about nutrition and disease is putting clinicians at a disadvantage for helping their patients to prevent disease and to combat health conditions as they arise.
Yeah, and this is particularly surprising given the fascination and almost obsession of people today with healthy nutrition and the proliferation of books for the lay public, generally written by individuals who are not always experts in nutrition. In my opinion, the medical schools really have to identify this as a major weakness and gap in our curriculum.
Yes, I agree. And I believe that there is some movement in that direction. Currently, there is a medical school in New Orleans that has its medical students go through cooking classes to help them understand better nutrition and what it means in preparing foods. So maybe we are at the beginning of a new way of training our future doctors. But there also has to be help from the insurance, the health insurance part of the equation. Doctors can refer their patients to dietitians to help them through their problems if there is some way for there to be some reimbursement for those services. So I think there has to be that angle as well.
Yeah, yeah. You were the principal investigator on two large population-based studies conducted at Rush University of risk factors for the development of Alzheimer's disease and cognitive decline, the Chicago Health and Aging Project and the Memory and Aging Project, studying tens of thousands of older individuals. Can you briefly explain what the goal of these large studies were and what you consider the main findings?
Sure. We started the Chicago Health and Aging Project in 1993 and took a community on the south side of Chicago and did a door-to-door census, identified all people 65 years and older, and then asked them to participate in our study. And almost 80% of the population did so. And we collected all sorts of information and measured health parameters so that we could identify those factors in their health and their lifestyle that would put them at increased risk of developing Alzheimer's disease. And we had very high follow-up during the whole tenure of the study, which went from 1993 until 2012. And we learned many things from that study, and it's actually used by the Alzheimer's Association and other organizations to report on the incidence and prevalence of Alzheimer's disease. I got funding in 1996 to add diet to the study so that we could look at factors in the diet that put someone at increased risk or help to prevent Alzheimer's and cognitive decline. And we got finding after finding. It was really almost shocking how rich the information was for revealing what in the diet protected the brain and put the brain at risk.
So you state in your book that it's remarkable how diet and physical activity are at the root of nearly all major chronic conditions and diseases. Do you think that the increase of Alzheimer's disease in Western countries is at least in part related to not paying enough attention to these two factors? It would seem to be easy and inexpensive and could save billions of healthcare expenditures if we paid more attention to that rather than investing billions of dollars in the end result of people affected by this disorder.
Well, I believe that the most important factor for the increase in Alzheimer's around the world is the very fast aging society. People live longer, and there's an exponential relation between older age and risk of developing Alzheimer's disease. So that's the primary reason why. It'll be interesting to see with the rise in obesity, that's not just in the US, but all around the world, and all of the conditions that come with obesity, what future impact that will have on the rates of Alzheimer's disease. We know that controlling hypertension and cholesterol levels and diabetes helps to protect people's brain with age and reduces their risk of declining in their cognitive abilities and also developing dementia. So with obesity comes higher rates of all of those conditions, including stroke, which is another primary reason for dementia.
Do you think that neuroinflammation, for example, secondary to obesity and metabolic syndrome, could play an additional role?
Well, certainly at the core of neurodegenerative diseases like Alzheimer's is oxidative stress and inflammation. Numerous animal models have documented how those factors are associated with Alzheimer's and other pathologies. So yes, there's strong evidence to support that they are a part of the disease. However, our direct measurement of risk factors and their impact on inflammation and oxidative stress is less direct. We have a lot more study to go to understand what happens in the brain with things like controlling hypertension and improving diet and exercise.
Based on your studies, what are the most important nutrients for the brain or for brain health? And do these recommendations apply only to Alzheimer's disease or to other chronic brain disorders like depression and anxiety as well?
So starting out with the most important nutrients for Alzheimer's disease, and I don't just go by my own research. When I formulate a hypothesis about what are the most important nutrients, it's based on our studies, but in addition, whether they are consistently reported by other population studies around the world, and also verified by animal models where all of the environmental conditions can be tightly controlled and they can look at the impact of those nutrients on the brain. So vitamin E, or the tocopherols, are one of the nutrients that's been consistently found through not only human studies that have looked at people's diet intake and then followed them over time to see who gets Alzheimer's, as well as animal models, clearly show that vitamin E obtained through the diet is very important for protecting the brain. It's one of the most potent antioxidant nutrients and one of the more important antioxidant nutrients in the brain. So it's thought that it does help to control oxidative stress in the brain and lower the risk of neurodegeneration and diseases like Alzheimer's. So foods that you can obtain vitamin E from are vegetable oils, including olive oil, nuts, seeds, whole grains, and to a smaller extent, green leafy vegetables. Another nutrient that has a multitude of scientific evidence from human and animal studies is DHA. This is one of the omega-3 fatty acids that one obtains directly through seafood. And it's been demonstrated to be very important, not only in neurocognitive development, but also protecting the brain with aging. And we found that fish consumption, which is a primary method of getting omega-3s or DHA in your diet, was associated with a 60% reduction in the risk of developing Alzheimer's disease and also slower cognitive decline. Another category is the composition of fats in your diet. Having an overall composition that's higher in the unsaturated fats and lower in the saturated and trans fats. And having a high saturated fat diet, we found doubled one's risk of developing Alzheimer's. Trans fats have less importance in the American food supply because of legislation controlling restricting the use of trans fats in manufactured food. However, in our studies before this was in effect, we saw that trans fat intake tripled the risk of Alzheimer's. So together, those are unhealthy fats that one wants to limit and increase their consumption of the unsaturated fats.
And how would somebody limit that intake or change the ratio between the unsaturated and the saturated fats?
The unsaturated fats would come from fish. That's the omega-3s. That's a type of fat. And vegetable oils is another primary source of fat. Other more minor food consumption would be nuts, seeds, avocados. All of those foods have a much higher proportion of unsaturated fats. And to limit the saturated fat portion of the ratio would be to limit your red meat and red meat products, fried foods like potato chips, French fries, pizza. A large part of saturated fat in the American diet these days is cheese. So limiting whole fat cheese is another way to control that or make the best ratio of unsaturated to saturated fats.
So when I listen to you, this really suggests that fats that come more from plant-based foods would have a benefit over those that come from animal-based foods such as red meat and dairy products. Is that a correct interpretation?
It's a little bit more complex than that. The studies that have looked at red meats, dairy products, fish, they have found protection from fish, but there isn't a strong literature that indicates that consuming meats is particularly bad for you, or even dairy. But what is known from a number of studies now, replicated all over the world, is that the saturated fat is important. So if you want to consume meats, I would go for the lowest fat composition, saturated fat composition of meat, or as an alternative, fish, which has, if it has a high fat content, it tends to be in the omega-3 unsaturated fat content rather than the saturated. So if you go for poultry or turkey or very low saturated fat items, that's much better for you than higher fat red meat products, bacon, sausages, and other red meat products that are very high in fat.
There's been a lot of attention focused on this point of the discussion related to this recent Lancet Eat report. Do you want to comment on that at all? I mean, there's been strong arguments in support of the recommendations, but also a lot of criticism that has sort of in the social media that has been brought up. What's, based on your experience with healthy diets, particularly healthy for the brain, what's your take on that report and the recommendations in it?
Could you be a little bit more specific about which Lancet report you're referring to?
The EAT Commission report that Willard has chaired together with a Scandinavian co-chair, and where they sort of make the close link between planetary health, climate change, and dietary habits and personal health. It's been sort of a major piece of work that's been thrown into the discussion about, you know, is it sustainable on the planet to continue the meat consumption and dairy consumption that we currently have without damage to, you know, to planetary health?
Yeah, well, I am not an expert in environmental health and climate change. But I have read reports of how meat consumption does lend to greater risk of environmental changes and climate change. And I guess that's just one very important additional reason to change one's diet towards more plant-based and away from meats. We know that it's so important for health, for so many different conditions, to be more plant-based and less meat-based. And I guess it's just one more very important reason why.
Changing the topic a little bit, what's your take on supplements? So this has clearly become a multi-billion-dollar industry. And given that, you know, we have access to, I mean, most people have access to a pretty complete diet. Is there a need for supplements, you think?
That's an open question for an unfortunate reason. The clinical trials, the major clinical trials on vitamin supplements have been conducted primarily in the US. And unfortunately, the US trials, and they were quite expensive and involved thousands of people, but they failed to target people who had insufficient nutrient status at the start of the trial. So nutrition is has a very interesting relation with physiological functioning. It really, the body is designed to keep nutrients at a very moderate level. And consuming them from food, you get a nice balance of nutrients that require each other to be absorbed, to be metabolized in the body and delivered to the organs. And once you start throwing that balance out of proportion, you can cause problems in the healthiest way that the body functions. So you can imagine that if you don't eat, you're not getting the nutrients you need, you can die. So having very low nutrient status is not healthy. But on the flip side, having way too much of a nutrient, either the body is very good at getting rid of that extra nutrient level, or maybe it's not so good at it, and it can be toxic to the human body. And so both high and low levels of nutrient intake are not what the body wants and needs. There is a moderate level that is optimum for physiological functioning. All of the trials ignored this principle and just gave very high dose supplements to anyone that entered into the trial, regardless of whether they needed additional nutrient intake from a vitamin. All of the trials have been negative. And so we don't know whether it's because those vitamins wouldn't help anyone, or that the design of the trial just wasn't able to test whether the supplement would be helpful to someone with low nutrient status. So I'll give you an example of a very well-designed study done in the Netherlands that was very cognizant of this nutrition principle. And they did a large trial of 300 people, and they targeted and enrolled only those people who had low folate status. And then they gave them a folic acid supplement, which is the synthetic form of folate. And they found that after 3 years, there was a significant decrease in their cognitive, their decline in cognitive abilities if they were taking the supplement versus the placebo. So the folic acid supplementation was very beneficial, significantly beneficial in this clinical trial that was appropriately designed to see if a supplement would overcome deficiencies in certain individuals. So the answer to your question, I guess, is that overall, if you have adequate nutrient status, taking a vitamin supplement has not been demonstrated to make you healthier, to protect your brain. And in some studies, like this folic acid study, if you are deficient in a nutrient and you take the nutrient supplement to get you up to normal levels, it may have a healthy impact on your brain functioning.
Okay, well, that makes sense. In your book, coming back to that, you make several specific recommendations for everyday eating and provide a detailed list of such categories and specific examples. In your opinion, what are the 5 top categories of food that are essential in a healthy diet?
So are you referring to the MIND diet?
Yes.
10 healthy foods to consume and 5 to avoid. Yeah, the top, if I was to name 5 top foods, I would say leafy green vegetables, other types of vegetables, berries, fish, and olive oil would be my top 5. And then foods to limit in your diet would include red meat and red meat products, cheese, whole fat cheese, and butter, and sweets and pastries, and fried foods.
So this is basically what's contained in the MIND diet that you have coined, capital M-I-N-D.
Yes.
And this is based on your research results. You mentioned the essential features. How does it differ from the DASH diet or the traditional Mediterranean diet?
Well, the way we came up with the MIND diet maybe is the best way to illustrate its relationship to the Mediterranean and DASH diets. Our group felt that it was time that there was a randomized trial of a diet intervention to prevent Alzheimer's disease. There's been about 20 years of research indicating that diet may be one of those very important factors in prevention. And yet there's never been a trial to test it. So we were wanting to target the best diet for this large trial. So we took the DASH and Mediterranean diets, and we're attempting to put something together with that. And then it occurred to me that we were ignoring all those years of research, all those studies that were focused on nutrition in the brain. So we decided to take the basic backbone of both the DASH diet and the Mediterranean diet, look at their primary components, because they have been tested in randomized trials, numerous randomized trials for cardiovascular conditions. So we knew they were healthy diets. And then we took each one of the components in those diets and looked to the literature to see whether how and whether we would modify each one of those components. So for example, vegetable consumption. The Mediterranean diet and the DASH diet simply say 4 or more servings of vegetables every day. But when we looked to the literature on nutrition in the brain, it was quite clear that leafy green vegetables was by far the most important category of vegetable for protecting the brain. So we made a separate category and said eat 6 or more servings per week of leafy green vegetables, almost 1 a day. And then we said consume at least 1 other vegetable serving per day. We didn't go higher, so we say 2 or more servings of vegetables per day, one of which is leafy green. We didn't set the bar higher because it looked like in the epidemiological studies, that was the level of benefit that we saw. It was 2 servings of vegetables a day. So then for fruits, none of the human studies show that fruits as a general category protect the brain against cognitive decline or impairment. But we did have studies in a vast animal literature targeting berries, that berry consumption was very important for the brain. So we didn't recommend 3 or more servings of fruits a day. We recommend in the MIND diet 2 to 5 servings of berries per week, which is based on the science on nutrition in the brain. So those are some of the categories that we changed from the Mediterranean and DASH diets. And again, it was just this process of taking a component of one of those diets and then looking at the literature on nutrition in the brain and modifying it or eliminating it or leaving it as it was.
But it's sort of interesting when, listening to your conversation and also reading your book and reading other books and scientific literature, it seems like there's a few components, such as the omega-3s, such as the varied plant-based fiber, polyphenols from berries. There's maybe a handful of these food components that seem to be explaining a large proportion of the health benefits or the benefits for brain health. Would you agree with that assessment?
It's difficult to say. In our trial that we have ongoing right now, we have a large trial of 600 people that we've randomly assigned to either the MIND diet or their usual diet plus mild calorie restriction, just 250 calories a day that we ask them to reduce. We'll be able to look at the different food components and changes and see if there is a single driving component, but it's very difficult to make that judgment on the available evidence that we have currently.
Okay. Another interesting part of your book I found is that you co-authored it with your daughter, Clare Morris, who contributed 80 delicious recipes to the book.
Yes.
Based on the lessons you learned from the MIND diet. Can everybody follow this diet, or is it dependent on access to the ingredients, like seasonal, economic, climate restrictions on the access to the ingredients?
Well, in the US, it's a lot different than if it was in sub-Saharan Africa, I think, with access to food. We get year-round access to pretty much any food we want. I know that people always question berry consumption in the Midwest in the winter months, but actually you can get frozen fruits year-round that are not all that expensive and have high nutritional content. So the MIND diet is not a difficult diet for anyone to consume. We've even done some preliminary analyses looking at cost, looking at, is it easy for higher socioeconomic status and lower socioeconomic status to consume the diet. And our first impression is that probably not. That if you look at many of the foods that are not good for you, they're pretty expensive. So if you buy a bag of potato chips, is it different than buying a carton of blueberries? No, it's just choices that you make. Reducing red meats in your diet, it can also loosen up your food bill because they're not cheap. So we're continuing to do this type of analysis, but there are many reasons to believe that consuming the healthy diet isn't as difficult by region, by socioeconomic status as one would think.
Okay, well, I would like to conclude this conversation with another quote from your book in which you say, "Food is central to the expression of love." What do you mean by that?
Well, the part in the book that you're referring to, I was talking about what's started my whole obsession with nutrition and food, which was when I had my own children. And I was trying to do everything I could possibly think of to make them the healthiest human being. And that was out of my love for my newborn child. And when you have family settings, it's all around food. And the expression of love to please your family members through the foods they eat, and community of the family around the table eating food is such an important expression of love throughout the world.
Well, thank you very much for this conversation, Dr. Morris. I just want to show again the book. I highly recommend it. I do recommend it to my patients. It's both entertaining and very informative about the topics that we discussed in this interview. Thanks for taking the time.
Thank you. I enjoyed this.